Dear fish keeper, dear aquarist, today something for the pond fish keepers, and particularly those that like koi fish, koi carps. They're very popular for those who have a beautiful pond in their garden, and I don't blame them because koi carps can be very beautiful, but also diseases can occur in that kind of fish. So here I was presented a case with a koi carp, Cyprinus carpio tosai, with an internal infection, which is was complicated. And that's still I want to show you because sometimes my findings are not so clear to show a worm or to show a particular lesion. And in this case, 110, well, we had something which is not so um, and definite to make a good conclusion. So it's worthwhile watching this to understand that it's not always easy for us with our naked eye as a fish doctor or as an examiner to find the real problem. The fish here, the koi tosai, was skinny and had some Popeye. And we had some losses in the aquarium, every day a few, from the group which we examined. Here we see the Popeye, we see some discoloration, but usually they're very skinny. You see the sunken belly here. See how skinny it is here at the back, at the tail. And when we opened the fish, we saw a lot of fluid and bloody red organs. We should normally be a nice, clear organs. Here the liver is very big. The kidneys here are very big, bit swollen. Here is the spleen. Here's some parts of the liver. And when we examined the organs, we saw the spleen here, which is all red patches inside. No tubercles and some vacuoles, some holes. Here also in the liver there were some holes, so the organs were not nicely formed. And here there are those big red patches, which is not normal. See, normally the spleen should be equal red tissue like this, but not these bloody clots, something like that. Also, the kidneys had some dark, like agglomeration of blood cells, blood clots, maybe agglomeration of dead blood cells. Could be all a reason for something that unfortunately we could not define clearly, nor examine that was a real pathogen. We saw some pathological issues in the organs. Yes, we could see that with the naked eye that the kidneys were not okay, the liver, the spleen. And for this case, I would recommend that you send the fish for proper diagnostics, for a bacterial and viral examination into the laboratory. And your fish doctor can help you how to proceed to present the fish like that to the laboratory. And that might tell you something serious going on and what you can do about it. And maybe a solution can come out. We also recommend that in the meantime that you start feeding the fish with a functional food. And in this case, we would propose, or Dr. Bassleer Biofish food, professional treat, and no other food for many weeks, which is perfect also for koi to take care of them during this kind of disease. These fish were eventually not sent to the laboratory, and they were treated with an antibacterial treatment in the food, and they recovered most of them. And this might be a solution you can talk about with your fish doctor when you need a quick solution, that you take action with a medication in the food, particularly for the fish which are still eating, and then make a selection of a proper antibiotic. I have more info in my books on koi carp diseases, in the practical guide and the new illustrated books, which are available in different languages, which you can find on my website, bassleer.com. And maybe you want to learn more about fish diseases and become an expert. I recommend you to follow my training on my Patreon. So, thank you for watching. Of course, I was not in the metro in Moscow. Look how empty it was. It was in the early morning a couple of years ago. I'm back home, working from office. And just the light went off from my aquarium. So that's why I'm more in the dark. Thank you for watching.